So what are warts?
A wart is typically a small growth that appears on a person's hands or feet and looks like a solid blister or a small cauliflower. They may also appear in other parts of the body. Warts have a rough texture and are caused by viruses, particularly one of the several kinds of HPV. What type of warts are there?
There are common warts and may appear in any part of the body, but are more common on the knuckles, fingers, elbows, and knees. Often they have tiny dark spots which are from blood vessels that have clogged.
Next, there are plantar warts. They appear on the soles of the feet, sometimes the heels and toes. They usually grow back into the skin because the weight of the person pushes onto the soles of the feet. They can be very painful.
There are also plain warts, which are round, flat, and smooth. They are generally yellowish, brownish, or skin color. They are also known as flat warts and are more common among children. They are usually found on the hands, legs, and face. Adults can have plain warts, but this is very unusual.
Next, there are filiform warts. These are long and can be usually found on the eyelids, neck, and armpits.
And lastly, there are mosaic warts. These grow in clusters on the palm of the hands and feet. What causes warts?
Different HPV strains cause warts. The wart-causing virus can be passed on by close skin-to-skin contact, as well as through contact with towels or shoes. The wart-causing virus can be spread to other parts of the body in the following ways. If somebody scratches or bites a wart, sucking fingers, biting fingernails can cause warts to spread on fingertips and around nails, and also shaving.
The wart affects the epidermis layer of the skin. What are some treatments?
The first kind of treatment is salicylic acid, which you can find in a cream, gel, or paint form at a pharmacy without a prescription. Studies indicate that salicylic acid treatments usually get rid of most warts within 3 months. Next is chirotherapy, which consists of nitrogen being sprayed on the wart, freezing it and destroying the cells. A blister develops, which eventually turns into a scab and falls off a week or so later. Laser treatment is only recommended for warts that are hard to treat. Photodynamic therapy is when the wart cells absorbs a chemical. This chemical is activated by light, usually laser light, and destroys the wart cells. Surgery, chemical treatments, and antibiotics can also be used to treat warts. Who gets warts?
Anybody could get warts. Most likely it's children and teens, people who bite their nails and pick at hangnails, and people with a weakened immune system.
Statistics of warts.
The overall numbers that were found for warts that were ages 14 to 19 had a 35% prevalence, 29% prevalence in the age group of 20 to 29, and then the numbers sharply declined with a prevalence of 13% at ages 30 to 39. The age 40 to 49 were 11%, 6.3% in the patients that were in the age group of 50 through 65. And when the numbers were cross-referenced and pulled from a different clinical sampling, the prevalence of HPV in U.S. women between 50 and 60 years old was just under 27%.
How many people in the world have warts?
There's no way to tell how many people in the world have warts because many keep it a secret. What can the public do to avoid becoming afflicted with this condition?
There is no real way to prevent warts, but it's always a good idea to wash your skin regularly and well. If you cut or scratch your skin, be sure to use soap and water because open wounds are more likely to get infected or warts.